Anything else?
But Sheriff, also like I know we a lot of people turn out of jail daily, and some of them just have nowhere to go. They wander around downtown, end up back downtown. Of that particular group of people, mixed in that has to be some people that have some mental disorders, but they have treatment available in the jail. Is that right?
That's correct.
Okay, so would you kind of tell us something about
Correct.
that?
Well, we do an incredible job. We spend approximately $27 million in treating mental illness in the county jail. And so we do an incredible job of stabilizing folks and making sure that we can, for lack of better words, restore folks so that they can be properly adjudicated through the court system. And through Judge Crocker's efforts, they get, hopefully the most appropriate sentences for their issue as well as for their condition. We're working very closely with the VA in that regard as well. But we do an incredible job in the county jail. The problem becomes that when we release them, they don't. There's no one there
don't follow through.
There's no one there to say take your medication. There's no one there to say get to the clinic. And so this is why the fighting the cuts at the state level is so important.
That's right.
And if you will recall, Pastor Nash, when I first became sheriff, I suggested to Commissioner's Court that we should use the old county jail building as a place where, right now I've only got one door to release people, and that's the door that leads to the street. And that door, unfortunately, puts people back into the circumstances and the environments that brought them there to begin with. My hope was that I could use my basement door to release people so that they could walk out to the old county jail, not use it as a jail, but use it as a place where churches, treatment centers, agencies that work with the homeless and the mentally ill, those subjected to drug and alcohol abuse, could be there to receive them, engage them, get them plugged into services quickly. According to the county health professionals and the city health professionals, they believe that there's about an 80% drop-off rate of people who leave the county jail system that walk into a treatment facility. 80% of the people do not go. And as a result, they deteriorate back into their conditions and recycle back into the jail, which costs the taxpayers a tremendous amount of money. Unfortunately, Commissioner's Court couldn't see the vision in that regard. I'm going to continue to fight for that. But in the meantime, we are doing some innovative things. We are doing what we call discharge planning. We do this specifically with HIV individuals, people who have been tested and identified in the county jail as being HIV positive. We now hand them off, literally hand them off to the community clinics so that they can continue on with their treatment. So for their own well-being as well as to minimize the infection, the spread of the infection out in the community. So look, these things won't make me the toughest sheriff in America, but I believe that these things will make Harris County the safest community in America. Because we have to think about how to get to the root issues. And so it's a matter of working with the churches, working with the treatment agencies, understanding where it all begins, and making sure that we have a good, firm hand inside the community to engage folks, and then looking at the inmates in a different light. As you know, Pastor, when I took over the sheriff's office, I inherited a mess. It had a horrible reputation. The Department of Justice had come in and investigated, still investigating us, and I don't believe in that approach. I want to make sure that people will understand the criminal justice system for what it is, have confidence in it, and that we are partners with all other members of the community in a way to change lives, save lives, and keep the community safe.
Excuse me.
That's okay.
One of the have HPD and the sheriff's office, you got to collaborate together. You work as far as if you pick up someone that has this mental disorder, you have data that once they come to the Harris County Jail, that they can have the person immediately evaluated, and that you have a system set up.
Yes, sir. Every person that comes into the county jail gets reviewed by our psychological staff immediately upon. I mean, it's a part of our processing of the inmates as they come in. But just yesterday, Pastor Nash, when I was on City Council and we were talking about this before the show, that I was so concerned about police officers being put in harm's way because people in the community only have one number to call when their loved one is going through a psychotic episode. And 911. And who comes when 911 is called?
The police.
Law enforcement does. And we are law enforcement. We are professional law enforcement. We're not psychiatrists, psychotherapists. We're not doctors. We're not nurses. And unfortunately, when people are acting out, it puts the police officers in a very, very difficult circumstance.
A defensive mode.
That's right.
That's right.
And so when I was on City Council, I built a program called the Chronic Consumer Stabilization Initiative. Mayor White and I worked together to provide funding for that. And I believe last year, HPD received a national award for that program.
They did.
And now, if I could have some more personnel, we could expand that. We could have done it sooner.
Right.
But just yesterday, I've been meeting with HPD, with Lieutenant Lee, and others, and we are building our own initiative because HPD stops at city limits. They don't have the resources for the county. And so we're going to be doing this for the Sheriff's Office.
Oh, that's good.
And we're going to be doing it jointly with HPD, MHMRA, so that our deputies can follow the same process that HPD is doing. Because the idea is this: there are a lot of police officers who are showing up for a call, and they're able to calm things down.
Right.
There's no arrest that needs to be made. Nothing, no conflict occurs. But the problem is that you leave that person there until they deteriorate.
That's it.
Again, and then the next officer has to try to calm it down again, and maybe they do. But unfortunately, at some point, an arrest occurs, a tasing occurs,
That's right.
and sometimes a shooting occurs.
That's right.
And we've got to stop that cycle.
Right.
And the program that I built, the Chronic Consumer Stabilization Initiative, was intended that when we first identify someone who's been who's got a mental health condition, that the next person showing up should be a clinician. Should be a doctor.
Exactly.
Should be a mental health professional.
Right.
We shouldn't wait for law enforcement to come back again.
Right.
And so we are in the process of replicating that for the Sheriff's Office so that we can support the greater community in terms of these issues.
Because we were really excited last week when we had George Crocker on the show, and she told us about that, because people didn't know that. That when you call, and would you have someone who's calling in, say I'm calling in about my son, nephew, or whatever, do I let you know when I make that call that he has this problem? Can you send the right people out? The people don't know that, but if they know that, they can say, he's having a psychotic event here, get somebody who can handle him. Because that, to me, is the difference between him going to jail.
That's right.
And getting killed.
And one thing to that was that, again, when I was on City Council, I got HPD to change their call-taking process so that the call takers would be able to screen that information out.
Right.
And that way they could give the deputies or the police officers responding to the call some preemptive information so that the officer doesn't have to think, oh, there's someone with a gun or someone with a knife or someone with a bat. I have to get into full police mode. But rather have them thinking, okay, I've got someone who may be unstable. I have to think in that regard. And we believe that has encouraged officers to do other things versus a standard police operation. That was one of the first things that I did for my call takers. They have now been trained in that regard. We have now a process to pull that information out of the community as they're calling, so that we can give our deputies good information. But we need a community response. Once our deputies have that information, do the right thing, we need a community response. And so it's all a partnership.
Right.
Miss Shirley, I'm sorry, I hate to intervene, but Sheriff Garcia, I'm feeling the passion in what you're saying, and Reverend Nash's passion. So as a community, myself, Miss Shirley, Reverend Nash, in the community, You was talking about that old jail, and that old jail. What do we need to go as a collaborative group to see Judge Ed Emmett to get that done? Because there's so many people released. Like, I'm a diabetic.
Yeah.
Okay, you shoot me up with insulin. I'm gonna go back to the old story. Then you
That's
put me
right.
back out on the
That's right.
street. I don't have any insulin. I'm gonna drop dead. There's so many people just walking out there.
That's
We
right.
as a community, we breaking the silence. What can we do? We know we budget short.
Good
That's
question.
an empty building.
That's a good
It's,
question.
well,
Question.
look, it's an empty building, but the building is still, for the most part, still good. We're taxpayers are paying for water, electricity, and air
We should be
conditioning in
using
it
it.
right now.
Then use it.
We need to use it.
And so I don't want to put anybody on the spot, but only to say that was a vision. And the idea is that I was looking at the county jail as in this sense. Pastor Nash, you and I, when I was on city council, we were fighting for additional transitional facilities out in the community.
Right.
But sometimes the community doesn't believe in it or
That's exactly
support it.
Right.
And so I thought, okay, the first step would be let's try a discharging process when people are leaving the county jail. Let's get them engaged. Maybe the next step could have been to use those old cells as dormitories, not as
Yes.
jails,
That's
but
right.
for the homeless.
That would be
That's
powerful.
right.
And get them transitioned, stabilized even
Right,
further,
That's
get them
right.
plugged into more services, and then moving them further out into the community.
agree with
And then
you.
maybe the community would have greater confidence
Yes.
that we weren't going to be doing things that would harm the community.
Right.
as a whole.
right.
Of course.
And so that was the vision. And unfortunately, I think it's still a good vision. I just think I was ahead of everybody's thinking. And so I would just encourage that vision continue to be massaged and see if it gets us to a better place. I mean, the city has already latched on to part of that vision with a discussion of their detox center.
Right. That's
That
right.
is part of the process.
Right.
And so it's a vision I put out there, and unfortunately they haven't latched onto it. And so I think that as you have your conversations with key members of the community, that we can continue to push this forward.
That's what I was saying. We need to just open it up so we have to break that silence by letting it
That's right.
do that.
That's exactly right.
Good.
This has been such a spirited conversation about with you, Sheriff Garcia. I almost hate for it to end, but we're winding down now, and we want to thank you for being with us
Yes,
on today.
My pleasure.
This has
Thank you
been
for having
a
me.
Good show today.
Right.
Thank you for all the information that you've given us, and that vision is not lost.
No.
That
No.
could be something that we all can,
community.
as a community, can work on, where that vision is not lost. That we may have a place for these people to go. And again, if you want some more information concerning the show, please call 713-731-7050. This is the community voice. It is for you. It's where we get information out to you that's going to help you. And again, we thank you so much.